Hey guys, welcome back to Dental Vibes. I'm Carla, and if you haven't checked out our other videos, please do so. Gabby and I are certified dental assistants, and we created Dental Vibes so we can keep you updated in everything that's happening in dentistry. And today we're going to talk about TMJ. Have you ever woken up with like a sore jaw or developed like some random pain around this area? Very tender to the touch, maybe a little bit of an earache or like a headache that just won't go away? Then probably like me, you have suffered from TMD. So I'm going to review with you my 5 tips on how to relieve some of that TMJ discomfort. And if you had it before, you know what I'm talking about. So this will be a great review for you. However, if this is the first time that you're developing any sort of TMJ or jaw discomfort, please, I have a huge disclaimer for you guys. You cannot, and let me say it very clearly, you cannot self-diagnose and self-treat TMD. This is very important that you seek first the advice of a doctor. And the best doctor to diagnose and treat it is your dentist, okay? So go ahead and call your dentist so you can get the best treatment for your case. Because if it's very acute, you may need to be referred to a prosthodontist or a pain specialist. Also, there are a wide variety of reasons why you may have this TMJ discomfort. It could be that your bite is off. It could be that you're developing some arthritis in your joint. It could be remnants from like a really old trauma that you've had to your head. Or it could be just as simple that you're just going through a stressful time. Maybe you slept the wrong way and all your muscles here are very tense. So please go ahead and call up your dentist so you can make an appointment and get the right diagnosis and the right treatment for your TMJ. The number one thing if you're having TMJ discomfort is, guess what? Ta-da! Wearing your night guard. If you've had it before, you know what I'm talking about, and you probably already have one. But if you don't and you're not familiar with this, stick around. I'll let you know what this is. This is fabricated by your dentist and it's custom made to your mouth. It's a hard acrylic. Sometimes it's soft in the inside and hard on the outside. And when you wear it, it stops you from clenching and grinding. Usually when we grind and clench our teeth, it's a response to stress. So maybe you're doing it subconsciously when you're sleeping, or if you have a long commute from work and you're like stressed out driving in traffic down the highway, or if you're at the gym and lifting weights. So you want to wear your night guard every time that you've noticed that you're clenching or maybe grinding your teeth. That is very important. Now, you may be tempted to go to the grocery store or the pharmacy and get one of those over-the-counter night guards. Let me tell you something. As an emergency, you can wear it and maybe you will experience some relief. However, those are not good for long term, and let me tell you why. The hard night guard, custom made by your dentist, it prevents you from doing all the excessive movements that is aggravating your joint. Guess what, guys? The one over the counter is a soft guard, and if you put it in your mouth, what are you gonna do? You're just gonna chew on it because it's soft. It's like putting a piece of gum in your mouth. You're gonna chew it. It's a reflex. So long term, it's really not great at all. It's just gonna keep aggravating your joint.
Hey, if this video have been information for you so far, make sure you give us a thumbs up. I mean, what else are you doing anyway, right? Just click that like button and don't forget to subscribe to our channel for more dental vibes.
My number 2 homeopathic recommendation is doing warm compresses massages. It's very easy. You basically just get a towel, wet it with some hot water, and you can even heat it up a little bit more by just putting it like 10 seconds in the microwave. Just be careful when you pull it out of the microwave. Make sure that it's all nice, warm, and not something that's gonna burn your face. And you wanna apply it to right here on the side where your joint is. Right here. And also sometimes I like to do it right after I take a hot shower. So it's like I could probably press it on my shoulders. And you're just gonna do like slow massages with the warm towel. Just like that. And you do it for about a few minutes, like 5 or 10. You may have to reheat the towel if it gets cold. But that's just like a great way to relax your muscles. Now this brings me to my number 3 tip, and that is remembering that your head is attached to your body. What that means is that there are many muscles happening over here, but there are 3 prominent related to the TMJ, and that's the temporalis, SCM, and your masseter. So when you're dealing with discomfort, if it's muscle related, you want to be able to like stretch your neck, stretch your shoulders, just be relaxing those muscles. You probably want to go out and get a massage. I've myself also invested in like little massage pillows to help me alleviate my muscles. Now my number 4th tip is just relax your jaw. If it was only that easy, right? Basically, if you're in discomfort, you want to avoid eating foods that are very sticky or very crunchy. So don't even think about peanuts, sticky candy, chewing gum. Please don't do that, because that's more movement in your jaw and aggravates everything. Maybe you want to keep track or be very mindful of what you could possibly be doing that is causing all your muscles to tense up. If it's muscle related, we already talked about, you know, are you clenching maybe when you're driving down the road, or if you're working out really hard at the gym, or if you're like me, you're a dental assistant, and sometimes, you know, we don't keep up with our ergonomics and we're like hunching over the patient. So those things, you know, just like tense us all up and we forget what we're doing over here. So if you find yourself clenching or grinding, just think about it. Press here, open and close. That's a simple exercise to just relax your jaw. You can also do the same and just kind of like move your jaw back and forth. It's basically just creating the habit that it's like you notice it, that you're doing it, or that you're tensing up, and it's like, okay, let me stop myself from doing that, because it just keeps getting worse and worse and worse. And sometimes when we have stress in our lives, it just comes and goes. It's periodic, right? So like if this is a chronic, it becomes a chronic thing for you, you want to be aware, like if you're having a stressful day, make sure to wear your night guard. Okay, lastly, my number 5 tip, and I'm very hesitant to talk about it, but I'm just putting it out there for your research, is taking over-the-counter anti-inflammatories. Now, with anything that you put in your body, please, especially if it's medication, you want to make sure you consult with your doctor first, or your dentist, or at least a pharmacist in your nearby pharmacy, because you don't want to take anything that you're not supposed to, that can make things worse and that is not safe for you. So do that research first. Don't just take my word for it. Remember, we have many other videos here in our YouTube channel. Don't forget to check them out. Give this video a like if you enjoy watching this and my tips have been helpful to you. Don't forget to subscribe to our channel, hit the notification button. Also, if you're looking for funny dental memes, check out our Instagram page. You're gonna love it, and I will see you next time. Keep smiling.